Good morning, Patience Ibe. Good morning.
Good morning.
You're welcome, ma. How is your network today?
Good morning.
Good morning, ma. Good morning. Are you hearing me? Can you hear me? Can you hear me?
Fine.
Oh, okay. All right. All right. All right. We are just, when it's 10 minutes after 10, we'll start. Just give some time so that Madam Nena and the other
Yes, I'm
person
hearing you.
can.
Though it's breaking, but I'm hearing you.
Okay. All right. All right. So we'll
I
just
can
give it
hear
almost.
you.
Okay. 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 We'll just give some time so that the rest can join us. Thank you.
Others can don't matter. Yeah, I understand. It's okay. You're welcome.
You're welcome. Oh,
Thank you, ma.
I'm happy to hear your voice today. How was your night? How was your night?
Eh?
Hello, patients. Can you?
Why is it cracking now?
Ha. Hey, Wahala. Please, oh,
My
let's.
night was great, and yours?
It was fine. We thank God for making it possible for us to see today. So, let's quickly have a rundown. I just hope. Let's just quickly look at how we are going to run down what you missed yesterday, and before others will join us. I'm glad you are able to hear me. Let's go. We will move very fast. We started from module 6, I beg your pardon. I think, yes. We started from module 6. So let's get there and just quickly run through. Good. Okay. This was we did yesterday. All right, Madam Patience, can you hear me? Hello? Hello? Patience? Okay. Hello, MJB, can you hear me?
Yes, I can hear you, ma.
Okay.
Good morning,
I
ma.
can hear.
Good morning. Good morning, Martha. I was thinking that I wasn't clear. That's why I asked. Thank you, MJB. Martha, good morning. How are you doing today?
I'm fine, thank God. Good morning, ma'am.
We thank God for today. I hope you are preparing for the...
I can hear you.
Okay. I hope you are preparing for the public health later today.
Yes, ma'am. Yes, ma'am. I am.
Okay. All right.
Thank you, ma'am. Yes,
Nice to have you. I wanted to
ma'am.
just have a rundown of what we did yesterday with Madam Pat,
Okay.
Patience, but she's still having, okay, she's even out of she's still having the network issues. She was only able to greet me and hear me at the first instance, and then afterwards I couldn't hear her. So I don't know what I can do again. I was happy when she came earlier, so we can do something before you people will join. So let's see. Just let's linger a little and see if Nenna. I hope Nenna has not forgotten that we have training today.
Okay, no problem.
Thank you. Let's just hold on a little.
Okay.
Hello, Madam Patience. Can you hear me, Patience? Okay.
Hello, Safi. Sorry, my people. I forgot. I almost forgot, in fact.
Thing now with
Major,
vitamin C
yeah, my major challenge now, because yesterday you had you had
is
issues.
there. Just say, put it under vitamin C. It's the same thing.
Madam Patience, I'm hearing you, but I don't know why you cannot hear me. I don't know. I've heard you talk about vitamin C, but you cannot hear me. So I don't know. So let's progress. Maybe somehow we'll see how to work out something if possible, because network has been funny. So good morning, everyone. Madam Nenna, it's nice to have you here. How was your night?
It was good. Sorry. Thank you for the reminder. I almost forgot.
I thought as much. You know, you forgot last week, almost forgot
Yes.
you. So maybe you're already used to the evening
I'm
thing.
not used to this morning.
Yeah, so you forgot. It's
Hold
nice
on,
to have you. Thank you. So
yes.
I was saying that I actually wanted to have a rundown of yesterday's work before we come to today. But I also observed that Madam Patience is still having the same issue of not hearing us. I don't know why. But she just talked now, shortly, talked something about vitamin C or I don't know, behind the background, and I heard it clearly, but she cannot hear me. So if I'm going to go back to
Oh my
yesterday's
God.
work,
What's
it's
wrong with
still,
network again
I
now?
tell you, it's still not going to help us. So,
It's cracking. No, I'm not. It's cracking.
okay, ma'am, we will just see what to do. There's nothing else. Network has just been funny. Yesterday, I thought today would be better. I actually prayed that today will be better, but I don't know. I don't really know. But I can hear you. I can hear you, but I don't know why you cannot hear me. You've just made a comment now. I've heard it. Okay, so quickly, let's move to what we have for today, which is the continuous professional development. In any as a professional, what is paramount and what is most important is that we continue to develop ourselves. We continue to upgrade ourselves. We continue to learn, relearn, unlearn, and so on. We keep learning because they said until someone actually ends it before you can stop learning. Learning is a continuous thing. So now today we are just going to practically look at, like I said yesterday, we don't have so much. We just have 2 modules left today. And all things being equal, we would not exceed, let's see where it will take us to. Of course, obviously, we wouldn't take 3 hours because we have 2 modules left, and we'll do justice to those 2 modules. Hopefully, we'll still have some time left. So, we want to look at module 9 and 10 is left. So module 9 talks about continuous professional development, like we said. It talks about how a person can continually develop himself in a profession. Like we tell people, you don't just, whether you're a pharmacist or in any profession that you belong or you are, you have to keep upgrading yourself, keep learning, keep getting better, keep getting better, keep upgrading yourselves, because different methods come into, times are changing. We have things that keep changing, so we have to ensure that we change with the times and we keep updating our knowledge so we don't remain in what we knew before. We don't remain irrelevant. Yes, so that's why we have to keep upgrading ourselves. So it's always beautiful when you walk into maybe a big pharmacy, where you see people, every technician, not only fills prescriptions, but also engages with patients. We've talked a lot about patients' engagement. Please go and tell your. So as I was saying, there are different things that we can do to upgrade ourselves. So it's important that as a pharmacy technician, You don't just stay like that, irrelevant. You transform yourself. You keep upgrading because the knowledge you learn would show in the lives of your patient. The knowledge you learn would be used to transform the patient's experience, and it will affect their well-being positively too. It will also help you elevate your career. Very important. So today we are going to see how we can make we can have the lifelong progress. You understand? That will become maybe a vital part of your healthcare journey. You understand, of your journey as a healthcare practitioner. So continuous professional development is very important for some reasons. We are going to see it on the next slide. We keep having the 4, we keep having the 5. That means, I think, whether Madam Patience keeps going out and coming in. My God, please help her to ensure network is not troubleshooting today. So what is the importance of ongoing learning and skill improvement? That we cannot even overemphasize. Today, we are going to really be looking at these things that are self-explanatory. This module is self-explanatory. Even without any form of explanation, you would be able to understand what is actually expected. Why does this thing keep moving? Please, I don't need stress. Okay, so professional development, what does it mean? What does it mean? Like we had already talked about on the other slide. So it's expected that you continually upgrade yourselves so that it can help you in the line of your duties as a pharmacy technician. We are going to see as we progress. Let's see how many people I am talking to. Oh, it's a pity, Madam Patience. Hello, Madam Patience. Hello, can you hear me? Can you hear me? Please, if you can hear me, you can just type on in the group, registered participants group there, please. Just let me know if you can hear me, because it's possible maybe you can hear me, but you cannot talk. Like you are answering and I'm not hearing, or something is wrong somewhere. Just let me
Oh,
know.
I can hear you. Me, I can
I'm
hear you.
trying to type a chat there for you. Can you hear me, Madam Pat? Please just respond if you can hear me, because and Madam Nena too. Maybe network has locked her out, or I don't know. So thank God that these slides are self-explanatory. It's not really going to stress you when you look at it. So why do we need to have continuous pharmacy technicians to keep upgrading themselves, to have continuous learning? One is to provide better patient care, like you can see there. It's important that we keep upgrading ourselves so that we can help these patients better, so that we can have the latest knowledge and skills that are necessary to develop, to provide high quality care to these our patients. And what are we looking at in terms of developing ourselves? New medications, keep yourselves updated with new medications. There are medications that go out of, and then you have to know that, oh, these medications are not in stock anymore. It's been taken off the market. You have to know this thing. So it's important that you keep yourselves updated with new medications, emerging therapies, methods of rendering therapy, and generally best practices in patient safety is important for us to note. Then it's also important that we understand drug interactions and side effects. You train in communication skills too that would help you to relate with your patient, because not everybody has the communication skills. Some people do not know how to relate with others. They don't know they don't have those skills that is necessary or important while communicating with other people. So this is very, very, very important for us. That is why we should keep upgrading ourselves and keep developing ourselves professionally, keep stepping up as we progress in our duties. We also have talked about improve. Another reason why we should upgrade ourselves is to improve efficiency. Learn about new technologies Streamline processes is important because when you learn, you know how to streamline processes and improve your workflow. We talked about pharmacy workflow yesterday. So it's one of the reasons why you should professionally upgrade yourself so that you can enhance your service delivery, so that you can reduce errors in medication, in giving medications, and so on, your service delivery. Very important. So now, it's it would also help you, to manage inventory. Remember, managing inventory is also part of your job. Manage inventory in such a way that you minimize waste and then ensure availability of medications. Like we said, we gave the illustration yesterday. It will be bad for someone that has trust, maybe has confidence in you and says, okay, let me get to that pharmacy and get these prescriptions that I was given, only to get there and the drugs, the medications are not available. That's a red flag. It does not speak well of you, and it's not even good for your business. So it is important that we keep learning, keep taking trainings, keep upgrading ourselves so that we can do better in this line of our work. Then advancing careers, you gain the skills, you gain the knowledge that is needed so that you can move higher in the hierarchy. From a pharmacy technician, you can decide to get higher certifications and go to school, graduate, get your pharmacy,
God,
become a
which kind of
pharmacist,
problem is this now? Which kind of
then
problem is this?
move
Yeah?
higher.
I'm not getting you. I'm not hearing you.
But I'm hearing you. That is the thing. I am hearing you, Madam Pat. I am hearing you perfectly. So if at all I muted it from my end, I wouldn't have heard you. So I don't know why. I don't know why. Nena and Martha, please, can both of you hear me?
I can hear you. I can hear you well. But
Okay.
just like the last training you have, the recordings too. Is it possible you make it available? So especially because of the app.
Okay, I think
You understand? Or something that can help her. That's what I'm suggesting.
Pardon, I cannot hear you well. What did you say, Martha?
Can you hear me? I was saying that, like usually during your training, is
Yes.
it possible to get the recording, especially because of Madam Pat, so that she'll be able to follow up from all these issues she's been having?
Okay,
That's what I'm suggesting.
okay, thank you for that suggestion. I would reach out to, I think MJB is already on the platform, We have different how do I put it? MJB will look into it. I think he will get the
Okay.
recordings. They record from their background. That's why sometimes you hear recording stopped, recording continue. It's from their end. So he's also here. The secretary is here. So I think he has noted that. I would also reach out to him concerning it. So Madam Pat, that's a beautiful suggestion. Maybe what you cannot get from us, you get it when you get the recordings and you get the slides as well. So sorry. It's actually network, because if Martha can hear me, Nena can hear me, then it means it is not from my end at all. Sorry about that. So let's continue. Maintaining professional licensure, many jurisdiction, it depends, not all. They need you to have continuing education hours so that you can continue to function. You can continue to defend your certificate as a pharmacy technician and continue to function in that particular field that you are. You cannot just learn it and then you let it go. You leave it like that. No, you have to engage in continuous learning so that you can be competitive in the job market. Maybe where you are is not even better. You want to move forward. Of course, you need to upgrade yourselves. Explore specialty certifications. Like I tell people, when you are into a particular field, look at the areas that you can specialize. Now, explore. You can decide to take courses on sterile preparation, how to sterilize. That sterile preparation, it's a special area on its own. You can decide to actually have a certification or be a specialty in the area of compounding medications. There are a whole lot of areas that you can actually specialize in. And you and I know that specialists in areas, when it comes to payment, they are paid more because of that special knowledge that they have. Not the general knowledge, but the specialty area that they belong. So if you are a pharmacist, there are a whole lot, a pharmacy technician, there are a whole lot of areas that you may wish to you may wish to specialize in that would help you in building your career, give you a better vintage position, and for you makes it easier for you to rise in the ladder. This is important. Understanding the role of pharmacy technicians. Like I said, this particular slides, this 9 and 10 is self-explanatory. There's really, it talks about professionally developing yourself, what you need to do. So it doesn't really need too much of talk or too much of emphasis. Now, pharmacy technicians are actually taking more roles depending on your area of specialization, like I said. They are taking more roles, engage in developing themselves. How can you take more roles? When you become a special, you have an area of specialty, you become a specialist, let me say so. Maybe you carve a niche for yourself. You see how highly demanding it will be because people will be looking out for you in terms of the financial aspect of it. You will earn higher, you have more opportunities, So it's important that you prepare yourselves as pharmacy technicians for the evolving role and contributing to the healthcare team. It's very important that you don't just stay like that. There are many online courses like we are going to see. There are many online programs that you get to learn, online courses that are flexible, that you'll be able to, in-person workshops and seminars too, a whole lot of things that you can, webinars. There are times we have their webinars, certification programs, a whole lot of certification programs that you can actually take online that will boost your profile and boost your portfolio. Conferences, annual meetings, don't just institutional training programs, on-the-job trainings too, because in pharmacies, we have the on-the-job trainings, or not only in pharmaceutical field, in any field. When you eventually start working there, you get jobs on the line, You get jobs and then you are being trained on the job. As you are working, you are giving trainings that will help you to be more efficient, trainings that align with the duties you are going to do, and a whole lot of things. So this is very, very important for us.
I don't understand what is happening. No, I'm just being cut off. Oh, I'm just being cut off. I don't understand what's happening. This kind of network, I don't know.
Madam
They're just
Patience.
cutting me off. I keep connecting and
Madam,
connecting.
Madam Patience. Everything will be recorded and made available to you. Okay. Maybe network is not allowing you to participate fully. So everything will be recorded, both the videos and everything will be recorded and packaged and sent to you. Thank you so much.
Madam Pat, I can hear you now.
Okay, Madam Patience, can you hear? Hello? Well,
oh, I'm not just happy at all. I'm not happy at all.
Madam Patience, the problem is this: network cannot be controlled. Network is not controlled from a central area, because if we were all in one place, we would have been able to sort it out easily.
Please do, because I'm not happy at all.
But we cannot do anything about it as it stands. It has to come from your end. Maybe your network, your data, the environment you are is not favorable. That's why yesterday I said that when we have online trainings, that we should if you use MTN is not working out, you can change to Airtel. It doesn't have to be your own line. It could be anybody can hotspot for you, your husband, your child, anybody can hotspot with another network for you to be able to get it. It doesn't mean that it has to be your own phone and your own network, because if Nena can hear, if Martha can hear, then it means that the problem is not from us. And if the problem is not from us, there's really nothing we can do at this point. I really feel so bad too. I can feel the frustration that has come. I'm not happy. Yesterday I was not happy, and today I don't like it. We are just few, and as such, I would love everybody to be carried along. But in this case, there is nothing we can really do. But thank God, Mr. Bassi, Mr. Mbre has just said that everything will be available. but that's based on the suggestion that Nnenna gave. So don't worry. Even if you don't hear my voice, everything we have done will be packaged and sent to you. So you will not lose out in any form. The only thing is you won't be hearing, you won't be with me, hear me as I'm saying it. You just have the recorded version. Please, I'm sorry about that, Madam Pat. I don't know if you can hear all these things that I'm saying. I'm really sorry about it. Okay, so as we were saying, we were talking about continuing education for pharmacists, that it is very important. You keep yourself upgraded, learn on the job, study. Some people, I've observed something that sometimes it's difficult for people to read, people to study. Over the years, when I formed these groups with BCC UK, MJB Management, we discovered that most of the things that are posted there, people don't even read, because there are people that have phobia for reading, phobia for studying. So, but as pharmacy technicians, we need to spare time. If you stop studying, if you stop reading, it is the end of, that means it is the end of it all. So for as long as you live, regardless of the age, 60, 70, 80, keep making sure that you are relevant. Read, study, keep learning and learning, because it's until the day someone dies that you stop learning. So especially in this field, it is important that we keep learning so that we'll keep updated with the current trends in medicine. Okay. All right. Now this one, the following slides will be talking about the different ways that we can learn. Online courses, like I said, we have online courses that you can learn, and the ones that I guess network, you'll be very, very prepared for, so that network will not be a challenge to you from your end, because network is something that is highly unpredictable. So it means that when you actually register for a training, you have to equip yourself with the network aspect of it. It will only be if all the networks is not functioning, because there are sometimes we have such issues, breakdown and so on. So online courses that are flexible and convenient, workshops, conferences, and on-the-job training, we've already talked about that. So all these things put together are things that you need as a pharmacy technician to step up, to upgrade from all the certifications you have, from all the knowledge you have, can place you in a vintage position for promotions, for higher salaries, and give you that exposure that you actually need in this field. That's important. So I don't know if you can hear me. Do we have any question? Because today I'm not even happy with this Madam Pat's patience thing. It's not encouraging at all. It's not. For the first time, I'm having such a challenge, serious one. Yesterday, today, someone in the platform is not able to reach, and we are not even many. If we were many, it would have been okay. So do we have any question? Martha, is there any question? Madam Nnenna, anything at all before I proceed? The last two modules are just self-explanatory.
Question at all.
Okay, so we can
No,
write.
no question at all.
All right. So now we have relevant topics based on pharmacy practice. Now, there are topics and areas of specialty that you can actually delve into that gives you that edge in the profession. Medication safety is one of them. You can take trainings, certificates programs, certifications. You have certifications that will actually give you knowledge that will actually keep you abreast as to how to handle medications safely, to promote patient safety, to prevent making errors, to handle substances, to handle these drugs, and how to use the sterilize, the aseptic technique that we talked about. Everything about the aseptic technique is to ensure that patient is safe, that the environment is sterilized, that is free, is void of any germs or safety concerns. That is that. So you can decide to actually take certifications in that area. So if you have the pharmacy technician certificate and you have another certificate, or you have yeah, you have certificates on maybe medication safety, on maybe pharmacology. You have some extra certificates, and someone that just has the certified pharmacy technician certificate, of course, you know, you stand a better chance when it comes to jobs. Every employer will opt for you, will choose you, because you have added certifications that will help you to function effectively. So it is important. Pharmacology, understanding drug interactions, understanding therapeutic advances, understanding all these things. You can be a specialist in pharmacology, even as a pharmacy technician. That tells anybody that that's your area of specialty. So even when you are working with a pharmacist, it's not a big deal, because the pharmacist knows that you can actually handle these drugs, you know the interactions, because you have the knowledge, because you have the certification. So this is important. Pharmacy technology too, learning about new pharmacy softwares and technology. Like we said, automated dispensing systems, electronic health records, and so on and so forth. All these put together and will give you that advantage that you need, because you'll be able to handle this equipment and know what to do. Patient counseling too. You can be a counselor. You can specialize in the aspect of counseling patients. And so if that's your area of specialty, there's a challenge in the pharmacy, they'll reach out to you because you have that certification, like you have the knowledge, you'll be able to communicate effectively with the patients, counsel the patient, let them know that it's important to take their drugs, let them know how to take it, find out, talk to them emotionally, and you know, everything is embedded in this counseling. Now, regulatory compliance too, the pharmacy laws, the regulations, everything, you can ensure that you upgrade yourselves, get just little. They are not expensive. We have a lot of these courses online that are just not expensive at all. So it is important that we actually note, we actually upgrade ourselves. We actually don't stay in one place, keep moving, keep going higher, keep updating yourself, keep upgrading yourself, you know, because it would help you to perform better at the end of the day. So like I was trying to say, there are times you have people, thank God you said you have, it's just sad that Madam Patience is not here, because she's one of those that I was praying that she would have a pharmacy, you know. So all the same, it's important that you note people that work for you. I'll still emphasize this. I think I said it before. People that work for you, make sure that they are trained. Make sure that they are trained. Train them. If you have a pharmacy tomorrow, and then you have people obviously that work for you, make sure that you don't just pick people, because what I see, especially from this part of the world that I am, they just pick people that don't even have the knowledge, people that are looking for jobs, just to ensure that, you know, you also employ people. You know, you just pick people, some out of pity, some out due to sentiment. You just pick them to do this work. No, they should be people that have the knowledge, because like Martha had said something the other time, that giving us an illustration yesterday, so that you don't have people that will commit such crime, will commit such errors. Because if you take someone that doesn't have any idea about drug, doesn't even have the certification, doesn't have the knowledge to your pharmacy to dispense drugs, or maybe to help there, at the end of the day, you'll be having issues. You'll be having serious issues as the pharmacist. Medication error, giving one drug for the other, and a whole lot of things, you know, coming into play, coming into the picture. This is not very good. It's not very, very advisable. So it is important that we know exactly what we are doing. Get people that are knowledgeable, and you to yourself, you cannot have a pharma. I've seen situations whereby people say, oh, pharmacy business, yeah, selling of drugs is lucrative, is this, is that. I've heard it severally. And they don't have the knowledge. They're not even into the sciences, and they've not even taken time to say, okay, let me actually know what this drugs are about. Let me actually have a knowledge of all these things. You know, it's always good to have a good knowledge of any business you venture into. Let's look at it in the business angle now. You know, some people will just say, okay, they open because they have the resources. They open a very big pharmacy, and then they pay a nurse, or they pay a pharmacist, you know, a pharmacist to actually be there and oversee. I tell such people that yes, the pharmacist will oversee, but the fact is that it is wrong. It is not good for you to run a business that you don't have the faintest knowledge about. So I advise them that even though someone is running that place for you, try to ensure that you take certain. You may not be a pharmacist, but ensure that you have at least to an extent 70% knowledge of what it entails to have a pharmacy. That's what I advise people. Don't just, and so beautiful. Thank God Madam Nena is here. I know with the knowledge that she would have to help her tomorrow. So even if you don't want to go further, you want to get people, pay people, to be pharmacists in your pharmacy, it's important that you have the knowledge. And like I said, as pharmacy technicians, you can decide to major in specific fields. You can decide to maybe focus on a particular field. It can be oncology. Oncology is simply a branch of medicine that talks about diagnosis and treatment of cancer. That's oncology. That's a field. It talks about the treatment and diagnosis of cancer. So you can decide to be a pharmacy technician in that particular field, in that particular aspect, such that when it comes to people that come there with issues of cancer, maybe come for medications, they bring prescriptions as a result of the cancer that they have, it will be handed over to you to sort it out. And you liaise with the pharmacist, but you have the knowledge. So with the knowledge, you will know best how to handle such situations. You know the drugs that are involved. You know how to advise the patient and a whole lot of things. Or it could be in the line of pediatrics. When you talk about children, pediatrics, a doctor that deals with children, pediatrician that deals with children, and the challenges that children have, the illnesses that they have. Or it could be geriatrics. Geriatrics is for elderly people that are elderly, old people, and so on. So these are different areas that you can actually want to delve into, or you can actually want to be. So there are other soft skills too. It mustn't really be the oncology thing, it could also be soft skills. Soft skills are interpersonal skills, little skills, things that you need in the course of interaction. So these soft skills are also important. It may not be the clinical aspect alone. The soft skills, learning how you can communicating effectively with your colleagues, with the patients, with the healthcare providers. You need to know how to communicate. Teamwork is also a soft skill. You learn teamwork, how to work with other people, because really and truly, there are people that find it difficult to work with other people. They don't know, they don't have that persona, let me say, so they don't have that ability to be able to relate with other people. And so most times they keep to themselves. Maybe again, it's their personality, yes, but you need to relate. No one is an island. So you have to know how to integrate. You have to know how to move about with other people, how to relate with other people, and so on and so forth. You cannot do it all alone, especially when in the healthcare field, because it's like a chain. It connects. It connects. All the members of the healthcare team connect. So you cannot stand alone on your own. So teamwork is very important. Communication, customer service. How do you relate with these people? Are you harsh? Are you inconsiderate? Or are you empathetic? Are you patient? All these things are soft skills that you can. Wait. So you can actually learn all the soft skills. So the importance of communication cannot be overemphasized. Effective communication, clear and effective. Now I tell people communication is a two-way thing. When you communicate, there are things that are involved in communication. When you are speaking to a patient, make sure you maintain eye contact. Let the patient make sure you also see the non-verbal cues that will make you know that this patient is listening to you. Sometimes, the problem we have is while communicating, even in our homes, even in our workplaces, even with our family members, we don't make it effective. Maybe we are talking to somebody in this era I remember which day I was talking to someone and the person was on the phone. was saying, yes, ma'am, I'm hearing you. Yes, doctor, I understand. What did you say? And all the yes and the yes, physical communicate, like we were face to face. But the person's attention was on the phone. He was fiddling with the phone, trying to do something with the phone, and was listening to me or hearing me, not listening, but hearing me, because there's a difference between hearing and listening. So was doing that. And I had to tell her, please, it means what I'm saying is not meaningful to you. It has nothing, it has nothing to do with you. That's why you are not paying attention. She said, no, I'm listening. And that was bad. I told her, you cannot be listening and be doing another thing that is taking your time. So when we are listening, give your full attention to these patients. Show respect. We've talked about respect. Show respect to them. Show the fact that, yes, go ahead. I am here for you. I've got your back. I'm here for you. What is the challenge? Listen wholeheartedly, listen attentively. And if you want to communicate from your own end, communicate in clear terms, in languages that they understand. It's just like you walking into a place to give, maybe they say I should go and deliver. There was a time I had to go to France to deliver a seminar. And, I struggle a lot with French, with speaking the French language. So when we had that seminar, we had to use an interpreter, someone that would interpret the language. And it wasn't I wasn't happy so much at the end of the day, because it would have been better if it was a language that I could speak. But they insisted that I take the presentation, like I take the seminar. So what am I trying to say? When you speak a language that someone understands, it's easier. When you are talking to these patients and you use the words that they understand, it's easier for them to assimilate. It's easier for them to do exactly what is expected, what you want them to do. But speaking to people that don't understand your language it doesn't work. I also gave an illustration. Maybe you want to say something, you want to sensitize, you want to talk with markets, people that sell in the markets, maybe, that sell in the market, and you go there and you don't come down to their level. You don't speak in a way, the language that they will understand. Let me use that. You don't come down to their level and align your speech make your speech to align with what they can carry and what they can understand and assimilate. At the end of the day, it will be a futile effort. So that's just the same thing. It's important that we learn communication skills. Very important. Sometimes some people cannot communicate verbally. They can use non-verbal communication, either through their actions, either through their body language. All these things are important. So our own communication too, let your words align with your body language. Maybe you are tired and you are stressed and you said, I'm listening to you. Oh, I can help you. I remember vividly some years ago when I went to the teaching hospital, that's the first time my dad was actually ill. And then we went there. So when we got there, the front desk, the lady that was supposed to give us the card for that day was supposed to bring out my daddy's card and then do those things. She was almost leaving. It was almost 12 noon for her to leave, so that another person can take over from her. But that's when we came. We rushed in an emergency. We just referred there. And the lady, this is not a nurse. I think she's just an admin staff where they check for the cards and all those things. So immediately we came in that state. You see, she wanted to leave. She told me that, madam, please, my shift is over. I need to change and then leave. Another person is yet to resume. The person that is coming is yet to be here. You have to hold on. So when she said so, I felt very bad. I told her, you mean hold on in an emergency? You can see what is happening to my father. And you're saying, hold on. What does it take you to bring out his card? But I was so angry. Normally, I don't get angry easily, but I was so angry at that behavior. And reluctantly, she went to start scattering the files. Her body language, the physiognomy of her face, everything about her. But she was actually doing that job. But she has communicated to me. She has already communicated to me that she is not happy doing that thing, that she's not in the best of moods as she's doing that. So what am I? She didn't need to tell me anything. She didn't need to tell me, okay, I should go. She will not do it. She didn't need to tell me that. But her attitude already, her body language has shown me that she doesn't want to do that. You understand? She's doing it grudgingly. So these are things that we need to understand. Let your words, let your smile, let your amiable disposition align with your body language so that it will give the patients a better outcome at the end of the day, the patient you are attending to. Teamwork too. You work as a team. We've already talked about that. You have to network with other members of the team to provide that care that the patients actually need. Customer service also. We've talked about customer service. It was a module on its own. How you relate with your customers, how you treat them, even when you don't have the medications, you treat them with respect. Okay, we'll get it for you. Or you don't know how to get, oh, we are so sorry, we don't have it. We just sold out the last stock that we had. Well, how can we be of help to you? Is it possible you can hold on? Let us, the way you talk to someone is very, very important. The way you talk, manner of approach is everything. I can want something from Martha now, and I speak to Martha in a way that Martha will not want to refuse me that favor because of the way I have spoken to her. She will not want to refuse that to grant me my request. And there is a way I can equally speak to her in another way. Martha will feel, no, I cannot give her that. It will not, because the manner of approach. So what are we saying? It is important that we showcase a good, positive attitude when we are relating with this patient to ensure that they are satisfied at the end of the day. Are we together? Can I write on? It's very, very, very quiet. Do we have any experience to share concerning the manner of approach or patient customer service? Is there any experience that we have to share? Is there anything we have passed through or anything at all that we may wish to share before we progress? I can see we are all 6 still complete. Do we have anything to share? Oh, patience is out. Oh, it's so sad. Okay. Martha and Nenna, please, are we together?
I'm here.
Hello?
I'm here.
Hear me?
Yes, I
I
can
can
hear
hear
you.
you.
Okay. There's this kind of experience. I don't know if it is in pharmacy way too, but this kind of experience, I had it in our profession, that's nursing profession. There are some patients, right, that the quantity of, that's the dosage of the drugs or injection which they are supposed to collect, you've given it to them. Then they will be pretending, especially, for example, maybe an analgesic drug. Then they will be there saying the pain is still there. The pain is the way they would do. Some will even tell you they can't breathe well. I hope you understand what I'm saying. Some will tell you they can't breathe well, and the way they will hurt if you are not being careful. That you are not being careful and you don't know what you are doing, you may just give them overdose.
Yeah.
Or you give them another drug. For example, somebody that just came out from theater saying pain is too much. But when you look at the chart, you see that this person has collected the dosage she's supposed to collect. Maybe after 3 hours or mostly after 6 hours. Before she can take another one. And she's there shouting pain, shouting, doing In fact, some will say they can't breathe well. Okay, somebody that can't breathe well is anxiety. You may just mistakenly.
Oh my
It's
God.
anxiety.
That is, I get you,
It's
Martha, what
anxiety.
you're saying. Yeah.
It's anxiety.
It can be
You just
frustrating.
mistakenly. Exactly. If you are not careful, you just mistakenly to go and grip hydrocort because she said she's not breathing well.
Yeah.
Meanwhile, it's anxiety. So there are some people like that there are some people like that you just have to watch them. You have to talk. In fact, it's not easy. You have to talk and talk and talk. Repeating of words to them.
That's correct. That's good. I'm happy that you are saying this. And no.
Yeah, it will just get to a stage. You just have to pretend and leave them. That you want to go and attend to another patient that you are calling. Meanwhile, you are excusing them.
You just want to
so
leave.
that you will not see them at all. Exactly.
Oh, that's it's a beautiful one. Sometimes these things happen, you cannot blame them because see, when someone is ill, my dear, thank God you are a nurse, so you understand what I'm saying. These people actually pass through a whole lot. And it takes patience, it takes understanding, it takes perseverance, it takes a whole lot of things for you to be able to actually calm them down. Some are actually in pain, and some the analgesic anesthesia that is given to them is actually maybe to subdue that pain for a while. So, and there are some that are emotional. It's just a normal thing. Aside even the health field, there are people that are naturally dramatic. Let me just say so. And you understand. So even when they are going through that pain, or maybe the pain is very small, something that they can contain, they cannot contain with pain. People are totally different. There are people that may have that challenge and they are able to contain with the pain, or maybe the pain is not too much, or it's even more. They are trying to enjoy it, but there are those that any little thing, so that is it. Individual differences comes into play. So the bottom line, like we tell, you see why we say that a healthcare practitioner should be patient. You should be empathetic, you should be patient, because sometimes, imagine like this scenario you said now, if it's not a patient person, in fact, you will not be able to tolerate some of the things you see in the line of healthcare. It's not easy to tolerate it, but in as much as it's not easy, when you have the right knowledge, when you have what it takes, you'll be able to surmount all those challenges, and you have humanity in view, understanding that this person is a human being and is only reacting like this because of what life has thrown at him or her. So thank you, Martha. That's a beautiful contribution. Okay, so we also need, like we talked about, interpersonal skills, which we have already. Active listening, pay attention to what others are saying. Do not interrupt, because interrupting a person shows sign of disrespect. So as much as possible, do not interrupt people when they are talking, or your patient is trying to say, this is what I'm feeling, this is how I'm doing this. And, because you have a lot of patients to attend to, you have to fill a lot of prescriptions. So you don't even have the patients, you just interrupt to cut the whole story short. It's not right. So try to listen and then show interest, feel their pain, validate what they're actually feeling. Oh, I know what you are feeling. I can understand how it is. I can understand how it is. At least that alone gives the person some form of assurance. Empathy, too, understand and share the feelings of others. That's empathy. We've talked about that. Express your thoughts and opinions in a clear and confident manner. Assertiveness. You have to be assertive when you are doing whatever you are doing in a confident manner, in a clear manner. Air your opinions and respectful manner too. Problem solving. Work with others to solve problems. Find solutions. Be flexible and adaptable to change. We've said that. Anyhow, as change comes, be adaptable to the change. Understand the reason why there is that change and bend with the change. Treat others with respect, regardless of their position or their background, no matter how they are dressed, no matter how you see them. A human being is a human being. So don't say, oh, this one has, because this one is a millionaire, this one is dressed like this. Okay, I need to attend to this one first. No, that is wrong. Treat people respectfully. And that is important for us to note, regardless of the things that we would see, like I said. So it's important that we develop these skills so that it can help us to improve our ability to communicate effectively with others, to provide excellent customer service, and overall, to make sure that we keep the health system moving. We have better patients, and patient safety as well is considered. Satisfaction too. So it's all these things are things that we cannot just overemphasize. Okay, so that's module 9, practically talked about professional development, how we can develop ourselves professionally, how we can keep moving, and so on and so forth to get better pay and better salaries. So this last module that we are going to take today, I am seeing how best we can not reach 1 o'clock. If we can try to reach 12 o'clock, that will be fine, because today we had 2 modules, and I was like, okay, let's take the 2 modules, and then maybe by 12 we can take 12 to 1. We can have a rundown of what we did yesterday for Madam Patient. But it's very also clear that today is still not favorable. So if I even decide to do that, it will be in futility, because she will not hear from her end. So the beautiful thing is she would get the recording. So we have to move. So let's look at this module 10, work-based learning and practical experience. Now, having learned all this online, having learned all these things, it is important that we have practical knowledge of what we are doing. Practical in the sense that we have hands-on knowledge of what we are actually doing, of what we actually learned, the practical aspect of it. Good enough, Madam Patience is in already having the practical knowledge, or had and is still having the practical knowledge of what should be done. Martha, you are also a nurse. Now, the challenge will be maybe Madam Nenna, because I don't know, but however, you can still see where you can have around your environment, where you can have practical knowledge of this, all what we have done, because it's important, hands-on knowledge of it, how you can actually put it into use in the practical setting that will help build your confidence and a whole lot of things. It is very, very important. Like you can see, these are students. You can see them in the field trying to use the equipment and use the materials for to count drugs and so on. You can see what they are doing. The other one taking stock, looking at the medications and so on and so forth. This is very important for us to do. Have the work experience, have the work learning of what we have actually learned. Now, what is the benefit of having this hands-on practice? Reinforcing, it helps you to reinforce your theoretical knowledge. Everything we have been saying, blah, 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 talking about, it will now be the time for you to actually showcase it, put it into practice. Hence, hence the work-based experience. Also, developing these practical skills that are necessary, medication dispensing, patient counseling, all these things. You do it live and direct. It helps you to develop the skills that is required, the skills that you need in the line of doing your duties. Building your confidence, this is very important. Many times, you see, there are times we have the practical aspects, even online, like some of the courses, but you know, you need to put your hands, use it, do it, use your hands and actually carry out. Let's have such scenarios and be tested to see whether you can actually handle them. You know, so these are things that is very important, because in the process of handling, when you keep doing a thing, practice, they say, makes perfect, and it will help build your confidence. You would have that confidence that no matter where the need arises for your knowledge to come, you can deliver. So how else can you have that confidence than you actually having the based the work-based knowledge? Then we have the networking opportunities too. How to network. You have opportunities to network, to connect with pharmacy professionals, other professionals, build relationships that could help you to go further as you progress in that career. It will help you, you know, for you to develop yourselves in that career. Practical training requirements. Every facility or different pharmacies have their own requirements. It's not cast on concrete, but some of them can be, you can make it. Tell him I'm doing training. Okay, so we have a lot of these things, overview of practical training requirements. We are going to be looking at what these requirements are for us to just to note in case you may need to go on internship or need to go and have practical hands-on experience of this. So we have some of these ways we can actually have this knowledge is through internships. You may be required to complete an internship training program. Again, externships too provide students the opportunity to have experience in food. So after what externship means, that's after the internship, you now proceed. There are most of the pharmacies that, because they know you have certification and you have the knowledge, you can proceed, you know, to have more experience outside. You know, you can even go out with them for outside experiences, visit hospitals, you know, have regular coursework, and is a continuity of your internship. Now we have the on-the-job training too, where you can build practical knowledge on the job that the employer provides the opportunity for you. You keep building the knowledge, building upon what you already have. Now you can also volunteer. There are cases where you may volunteer to help. You may volunteer, like I tell some of my students, if they don't have opportunities for internship and all that, I tell them, why don't you volunteer? Because obviously, if you want to volunteer to help, to render assistance in a hospital or in a pharmaceutical setting, you are building your own knowledge and you are also rendering service to them there. You are also helping them over there. So you are doing two things. They are gaining from you as well as you are gaining from them. So it won't be like the normal, the full internship that they won't have to pay you when you go there, for the internship. So that's just the way it is. You need to keep practicing to develop these skills and the knowledge that you need that will help you provide high quality care to the patients. Now, developing, let me see. Oh, yeah. That's 191 and we have, all right. Just wanted to be sure. Just wanted us to be sure as to what is left for us to take. All right, so now developing a resume and cover letter. This is what I just wanted. Normally when we have these trainings, we have most health trainings, we do give them guidelines as to how to put this together. So getting a resume and a cover letter, you ensure that you craft a packaged and structured resume or cover letter in most cases for you to be able to secure maybe an internship opportunity or for you to have the opportunity to work somewhere. Like I tell people, we have different types of CVs, we have different types of resumes, and it depends on the country you actually want to work, and we have the Europass, we have another type. Okay, no need to even put you through, but there is how most of the time you hear people say, oh, I submitted my application. I submitted, I dropped my CV. But again, what happens to most of these CVs and these applications is if they are not properly crafted, if they are not properly structured to meet the template of that particular country. For instance, those that maybe want to relocate, they want to be pharmacy technicians outside the country. Over the years, we've had a couple of them. And so we try to help them see how to put together their CVs. We make them to put it to align with wherever, the countries in question that they need. And what we do, because we won't be able to take all the countries, what we do is we give them the major two types of CVs. Any of them. So the one that goes with Europe, that goes with US, UK, and all those, you use it. The one that aligns with Nigeria and maybe other countries, Ghana, and so on, you use it. So we try to guide them through. So these things are very important. Now, let's look at some of the things. Now, in your resume, you have to put your educational background, including your pharmacy technician program, your certification, when you are putting your CV. For instance, now you already had your CV. Of course, you have to include this one that you have when you eventually are done with, graduate and get your certificate. You have to include it. Highlight your relevant skills. Those skills that you are very good at doing, those skills that are related and very relevant to the pharmacy technician profession, like managing medication dispensing, counseling the patients, inventory management. These are skills that you need to include there. Then your experience too. Sometimes, and in most cases, they will ask for work experience, or, that's if you are looking for a job, they'll ask you for work experience. They want to know if you've actually experienced, you've done this pharmacy work. Pharmacy technician jobs. If you've carried out those jobs in any formal setting, yes, they want to have some of those things, including maybe volunteering. If you've done volunteering work, I told you that volunteering is very important. You can volunteer, and at the end of the day, obviously, they'll give you a certificate stating that you volunteered or you carried out your internship in that place. It's a plus, especially outside. They love to see people actually give themselves as volunteers. So when they see that you are already on the right path, then certifications too that you have obtained, like this CPHT, that's a certified pharmacy technician, And then your accomplishments, your awards, anything that you know will boost your portfolio, that will give you that edge that we are actually looking for, are things that should be contained in a CV and in someone's resume. Very important. Okay, we are almost rounding up. Today's session is short because of the 2 modules, and those 2 modules are self-explanatory. So another thing is interviews. Interviews, this is something that used to be nerve-wracking. Like you can see there, interviews are things that get people nervous, that gets people worried, you know. But I tell them, take your time. Exams gets people agitated, exams get people anxious. But the thing is, in the midst of all this, it's okay to be anxious, but don't allow your anxiety get a better part of you. Don't. It's okay that you get anxious when you actually need to take an exam or you have any major challenge. There is definitely going to be an element of anxiety, but do not allow your anxiety to take over the best part of you. That's very important. Also, when you are having interviews, research the employer. I tell people, research. If you are having an interview somewhere, maybe in a hospital, in a general hospital, research details. Technology is so beautiful. You can get any information you want online. Research, go have a background check on the employer, research them, learn about the pharmacy, learn about the organization where you are actually going to get the interview from, you know. Then practice common interview questions. Practice. Who are you? Please, may we know more about you? Can you give us some insight as to who you are? And they can ask you in different ways. Tell me about yourself. Why are you interested in this position? You should know that the major thing that can make someone interested in a health position, because one of the major things is because you want to impact in life, you know, patient's life. You want to reach out to the vulnerable. You want to be able to have satisfaction in the fact that you are able to help someone that is in need. All these things are related positions. Yes. Ask money. Now you practice your responses aloud to build your confidence. What I used to tell people is when you have a presentation or when you have an interview, to carry out, look at the likely questions. You can tell your husband, please, I have this interview. These are the questions I've been able. Can you ask me? Let's have an interview scenario. Ask me these questions and let me answer. So you now get into character. That's how the movie people call it. You now get into character, and you'll ensure that you do it real, like your husband or wife, vice versa, or your child or your, or anyone can just take that part as the interviewer, and you the interviewee, you begin to answer, the questions the way you would. That way, when you do it once, you do it twice, you build that confidence that will help you to give any responses that will arise. Dress professionally. You can't talk about
Hello, what happened? Can't hear anything.
Same here too. I can't hear anything. Everything just go off.
Sorry, she's having network issues. She'll come back. It just went off. That's our network. Sorry.
Okay, no problem.
Oh.
I have to buy another data quickly. Hello, Madam Martha and Nena. Please, can you see my screen?
Yes, I can.
Okay,
Yes,
I was,
can.
all right, thank you. I was just locked out. I was
Oh,
just locked out time, so I had to come back again. Today is a good day, really good day.
sorry about
Okay,
that.
thank you, thank you. So we were talking about the dressing and preparing to ask questions. It's important we ask questions in interview scenarios. And some people say, I don't want to ask questions, it will seem rude. No, ask questions, make your clarifications, clear your doubts. Let me just say so. Follow instructions. Be punctual. If you have to, by the time you get the job,
In
maybe you
short,
get the job.
I'm feeling bad. So,
Oh, Madam Pat, I don't know how to, but I don't know what to do. Truly, I'm feeling even as bad as you are feeling. It's sad. Just you, just you. So obviously, it's not from here. I don't know what else to do, but don't worry. I'll just give you a call when we are done. I'll give you a call so that we can talk when we are done with the training. And then we'll see how very fast and best that we can salvage the situation. Maybe to give you the records as soon as possible. So sorry, Madam Patience. I'm sorry about this. So this is follow instructions, when you actually are working or you are doing your internship, follow instructions given. Don't be an island. Don't do what you want to do. Don't be, you know too much. Don't hesitate to ask questions about your role or your expectations. I mean, the expectations of your employer, what they expect from you. Please ask. It's always good. They say someone that asks questions does not lose his way or her way. This is important. Okay, and then working with the healthcare team, collaborating with the healthcare team. That cannot be overemphasized. Working with other members of the healthcare team to provide comprehensive care to the patients. They need the care, they need the support, they need the love, they need everything that they can get, this patient. So you have to work with the healthcare team. Everybody works hand in hand together to ensure that at the end of the day, everything works out well. This is important for us to note. Like you can see there, the doctors, nurses, CNAs, the pharmacists, everybody has to work together. Effective collaboration is important, is essential for ensuring that these patients receive the best care ever, like you can see here. So we are almost getting to the end, and it's just to walk through from everything. So working alongside pharmacists, nurses, and all these other healthcare professionals you need communication. You need to be open. You need to be honest. You need to be able to communicate effectively and clearly with others, like we said. And two, you should have a clear understanding of their role. What is the role of the nurse in the healthcare? What is the role of the doctor, so that you don't overstep your boundaries as a pharmacist or as a pharmacy technician? Know your role as well, because it will help working together easier. And by so doing, you can avoid misunderstandings. You can avoid having the issues and then the misunderstandings from time to time. When you understand what you're expected to do in a workplace, everybody understands their own duties. It helps avoid squabbles. It helps us to avoid misunderstandings along the line when we are carrying out these duties. This one will not say, I was supposed to do this, you are doing my work, and every other thing. At the end of the day, the understanding will help people to serve the patients better. Sharing information, share relevant information with other members of the team. Relevant informations that are needed with other members of the healthcare team, such as maybe the allergies of a patient, the drug interactions, and the patient's progress. If there are any other issues, maybe the patient is not taking the drugs according to how it's supposed to be. It's important the doctor notes or the doctor knows, you know, so keep track of all these things. Contribute to care plans. You can contribute to the care plans, developing care plans for these patients in some cases when the need arises, because your own knowledge as a pharmacist, you know the computation of drugs. Let's look at maybe pharmacists now. You know how drugs are composed, you know, put together. You know how to compound this drug and with this one to give you this effect. So you have a very essential person in the line of this in the line of the healthcare. You are very important because your opinion is highly important and valid when they are trying to put together medications for the patient. Address patients' concerns too. Address their concerns. Provide information about their medications. If they have any issues, they have any challenges, they are taking the drugs, the medications they were given and their side effects, it is in your place for you to address their concerns. Reach out to them, find out how best you can help them, and don't hesitate to actually help them at the end of the day. Now, patient care as part of the healthcare team, contributing to patient care. That was the other slide that we also... Why is it not moving? Okay, contributing to patient care. It is important to ensure that we contribute to the care of the patient, like we already said. Even as pharmacy technicians, you don't have to be a pharmacist to contribute to the care. Ensure medication safety. That's how you can ensure that you don't interchange drugs. Very important. Ensure that you cross-check, you double-check prescriptions before actually giving the drugs to the patient. Educate the patient about their medications and answer their questions. This is important. Answer their questions. Give them answers to their questions, address their concerns, monitor the outcomes, track the progress, patients' progress and changes to the pharmacist. Tell them, let the pharmacist know, because like I said, these people is like the father of the house. The father gets not most times because of his busy schedule, he doesn't get to know most of the things that happens in the house, but you, the mother, knows better. So let's see like an assistant to the father. Most things that happen, you are the one that will bring it to the notice of your father. So that's how a pharmacy technician is. Most of these things, most of these issues, following up the patients, all these things, you are the one to bring it to the notice of the pharmacist. And then you work with the pharmacist or to ensure that these concerns are handled. Participate in quality improvement initiatives. Important. Quality improvement initiatives. Anything that would help, you know, in improving patients' outcome, will help in maybe reducing the medication errors, will help in maybe making patients to, in the course of counseling patients to ensure that they adhere to their drugs. Anything that will serve as an improvement, so long as it does not add harm to the patients, it instead creates a positive improvement, then you have to key into it. By doing all these things, you as a pharmacy technician, you can play a very major and important role in ensuring that these patients, these vulnerable people, those people that really need help, receive the best care possible. Like you can see, we have some pharmacies that are very big and beautiful, just as you've seen this one. And the people doing their work, spacious, the drugs are arranged, everything is kept in such a way that there's easy access, inventory is taken, and so on and so forth. The place is clean and neat at the same time. So, yes, to God be the glory. At this point, I want to say congratulations to you for having come this far, or every one of you. For Madam Patience, I think she'll get her congratulatory message, even though I know she's not happy with what's happening. But I want to say a big thank you to everybody. You have come this far. You have learned, at least added something. No knowledge is wasted. You have learned and added to what you already knew. And you have successfully just gotten the knowledge that you need, at least the theoretical knowledge of what is expected of you as a certified pharmacy technician. So at this point, I would like to ask Madam Nnenna first. Madam Nnenna, I would like to ask you to, we've come to the end of this training. I would like to ask you to just give us maybe 2 or 3 bullet points, 3 things that you have actually learned from the beginning of this training up until now, and how you would actually use it when you own the pharmacy that we have all prayed for, the big pharmacy. So I would like to hear what you have actually learned so that I'll know that at least our efforts for these 4 days has been worth the while. So the floor is open. Madam Nenna, can you hear me? Hello?
Hello, madam.
Yes.
Yeah. I learned, yes, one of the things, especially about what pharmacy technician is all about. The duties to assist the pharmacist, and so many duties of pharmacists to assist in dispensing, filling of prescription, compounding, and sterile compounding. I've also learned, like, before now, when I see prescriptions in the hospitals, when I see all those affirmations, it's very difficult for me to understand what they are saying. But with this training, I'm able to understand it perfectly. And when I see such, it's easier for me to explain. Then I've learned classification of some drugs like antihistamine, analgesic, antihypertensive, classification of drugs, then the different types of naming, that's drug names, like brand name, the chemical name, and the other name,
The brand
generic
name, the chemical name, and the generic name, yes.
the different, like when I see some of those drugs, you see them having different names. But with this training, I'm
That's
able
right.
to understand what's actually is going about these different names you see. You understand? It gives
Thank
me
you so much.
back knowledge, and it's a good training. It's a good training.
Thank you. Thank you so much, Nenna. Even though network is funny with us, I really appreciate that. And
so, but I want
thank
to ask.
you.
I'd
Okay.
like to ask, yes, apart from probably working in pharmacy and working under a pharmacist in a big pharmacy, what other opportunities
You can work in the hospital.
okay,
You
in the
can
house?
work in the hospital. You can work in clinics. You can work in health centers. Anything that any place at all that involves drug dispensing, that involves people needing access to care. You can even work in, there are schools that have, maybe schools, organizations that have their own, like we talked about, what was I saying? We have veteran pharmacies, that's places where it's reserved for veterans, military men, and their families. Any setting at all that involves drug dispensing. It doesn't really have to be in a big pharmacy. It doesn't even really mean it has to be in the hospital. It could be in big organizations where they have pharmacies that they dispense drugs. It could be in the military, like we said. So there are a whole lot of opportunities. You can work anywhere at all, even in the war front, as God forbid, I'm not praying we have war, but even when there is war, sometimes we have people that are specialists in when there is war. Their own duty is to dispense drugs, is to know what is the condition, what has actually happened. Now, okay, what can we do? This is the drug we are. So it's a broad thing. You can work anywhere that has got to do with drugs for someone aside hospital and pharmacy.
Yes. Okay. What about working on your own? Is it possible? As in working for
Pardon? What
yourself?
about?
I mean, as in working for yourself now, as in maybe having a store, medicine store, something like that. Is it possible?
Yes, that's what I want to say. That if you can have a patent store, is maybe a small, you can have a chemist, it's just a small shop that you have. We had examples of this pharmacy, maybe a small shop where you just sell, yes, so where you can just sell medications. But when it comes to big pharmacies, It's going to be a challenge for a pharmacy technician to own a pharmacist because you will have legal, it has legal implications because when they come around for checking and all those things, they would need to see that you are a pharmacist to own a pharmacy. That is why some people are like you are now. You can be a pharmacy technician, and you want to own a big pharmacy. You hire somebody. You can pay a person that is a pharmacist. Yes, that will be in the front desk in case of any that the person's qualification, everything that they will use for all the processes. Confirm the person is a pharmacist. The person is eligible to have a pharmacy and all the processes. Yes, but that is for you to be doing interimly before you can actually become, because as a pharmacy technician, you cannot own a pharmacist. It's as clear as anything in any country. Yes, but you can, it's like a stepping stone for you. So you can still decide to get certifications. You can still decide to, maybe you are still very interested in it. You can go higher and become a full pharmacist, go to university. And then with your pharmacy technician, it gives you that advantage because you already have the background knowledge and everything that is involved. You just want to have the certification. So that is it. You can own a chemist. You can have these small stores. The measures are not very stringent, especially in Nigeria, this part of the world. You won't have so much issues. So far, you have your certification as a pharmacy technician. But if you want to go fully blown, you want to have pharmacies where you have some drugs that are restricted, some drugs that are controlled, and a whole lot of drugs like that, medications, you need to be a pharmacist so you don't have issues with the government. Yeah.
Yes. It's okay.
So, okay, thank you. So, Martha, what have you learned? I'm sure Madam Nena has not said everything because the way Madam Nena was saying those things,
I'm asking.
I'm wondering what will be left for you. Can you hear, Martha?
Yeah, I can hear you.
Okay, so I would like to know what you have taken home so that our efforts will not be futile. I'd like to know one thing that you've taken home that you've taken so far these 4 days.
Okay. At least on my own, I understand that like there's this kind of mistake people do. Maybe don't take money drugs. You take it together at once, maybe at night, at evening. I now understand the importance of it. The dosage you're supposed to take is what you will still take. Then I understand better that if you take them drugs, it depends on the hour. So you follow the drugs hourly the way it should be done.
Yeah.
For better work. Then another thing is that I understand one thing I now understand again is that at least we nurses, if we are giving a patient medication, should be very careful. No, maybe like from some private hospitals, nurses dispense drugs.
Of course, yeah.
Yeah. So this will be an advantage thing to me if I go, if I'm on that establishment, yeah. If I find myself there, at least I can do better by God's grace. So that is in the area of prescription. At least I gain much on that, which I so much like. Yeah. Okay. Then when you're taking drugs to give patients, be very careful because so that you will not dispense the one that will make the patient to buy. That is
of course.
It's true.
Matter.
Yeah, to buy. Okay. Exactly now, especially we nurses, because some nurses are careless. I must tell you the fact.
That's correct. That's true. Thank God you have owned up to it.
Yeah, so they will like, maybe the drug is on the patient desk, you just carry, you give. You don't know if they have said discontinue. You don't know anything, or if it's reaction. You are closer to the patient. You are supposed to notice the patient's reaction. You just, maybe you are in a rush, or they are much. Even though the patients are much, take your time. Don't rush because of the take your time. So at least
and do the right thing. Yeah.
Yeah, do the right thing. Yeah, exactly. Do the right thing. Prescribe right. Give right drugs. Because there are some patient stores. Sorry to bring this up because it used to make me, It used to make me get angry. Serious one. Patient is not feeling fine. They will come to your store. They want to imagine patient would just diagnose themselves and say they're having malaria and typhoid.
Yeah.
Yes,
Of course.
yes, ma. I've come in contact with many. I'll tell them, how did you know you have typhoid and malaria? Did you do any test? They say no, but as they do me, you know. And before you know, the pharmacy there, or I don't know what I will call them, they will give them
And what they want, the drop, yes.
what they want, all
yes.
sorts of mixture. Oh my God, this thing makes me get angry. There's one patient I even collected a drug and start naming the drugs, because thank God I'm gifted on that. I started telling her, this one, that all the drugs they gave you is only one tablet of malaria that is here. He said, it's a lie. I showed her. This one is malaria drug. This one is what they call it, Flagyl. Indoseed is there.
Huh?
Ampiclox is there. Yes.
Don't mean it.
Indoseed is there. Ampiclox is there. I was like, you are killing yourself the more.
They just want to sell it.
I'm telling you. So I told the woman, please, if you are sick, do the test. I know there's no money, but it's better. Go to the better place. Let them give you better treatment. Not all this mixture of a thing. So at least with that, somebody can take it up. How I wish that pharmacy council or whatever can take it up. I would have been very happy for that. Because this thing is cutting the people's lifespan. So
that's a beautiful one. Yeah.
So I really like it a lot. Yeah.
Thank you.
There's another thing I want to ask. Are we doing internship or no internship?
Well, I think MJB management will respond to that.
Okay.
Respond to the angle of internship, but to the best of my knowledge, the internship does not lie under our jurisdiction. I think when you are done, you now proceed to do your internship. That will be your own arrangement. But I am not speaking for MJB. I think they will respond to that after they're done. Yes. Maybe we'll need to drop it in the chat box, or in the group by the time we are able to reach them, or the secretary will respond if the director does not. So that's it. I want to say thank you for your support. You've been wonderful. In fact, you have made the training lively, because when I was told to take this training, I was like, only how many people? They told me the people are few. That the fact is, this is December. I think people are thinking how to buy Christmas clothes, and they're not really thinking how to do this. So because we used to have a good number, we used to have many when we do this training, but for the first time they're having this number. So that notwithstanding, I want to say thank you to you, and to Madam Nena and to Madam Pat, for taking time. And I want to assure you that truly this training you have taken is not a waste. You may never know when it will come in handy, and you would know that you actually took the right decision to take the training. So thank you so very much, especially you, Madam Nena. It's nice to have you here again after taking the CNA with us. And then Madam Martha, it's nice to have you too. Madam Martha, I don't know if you have a first aid or CPR certification, because the way you are sounding, you are already in the field. So you should have BLS or that.
I have BLS. Yeah.
That's good. Thank you so
so
much.
So what I'm looking for now is what they call ASL.
Advanced cardiac life support. Is that
Yeah.
ACLS. All right, no problem. Thank you so very much. Over to MJB Management and Integrated Services. Hello.
Thank you. Thank you so much, Doctor. Thank you so much. We've come to the end of this program. Thank you, Madam Martha. Thank you, Madam Nena. You guys have been wonderful. Thank you so much. We appreciate you so much. Then for the certificate, any information that we need, we'll drop it on the platform, so that on how you get your certificate on, and also the name and other things we need. Thank you so much. I don't know whether any of us we are attending the next program that is starting in the evening by 5. That is talking about public health. Madam Martha, are you
Yes.
there? Or Madam Nena? Are you there?
I'm here. Oh no, I'm not. I didn't
Okay,
register.
all right. Okay. What about Madam Martha? Madam Martha, are you there?
I'm there. In fact, I'm number 1.
Okay. All right. It has been a wonderful time. Do take care of yourself. We'll meet you. Bye for now.
Okay.
Bye-bye.
Thank you.
Bye.
Bye-bye.
Thank you. Thank you.
Yeah. Nice meeting all of you.
Same here.
So,
Bye-bye.
Same here too.
Okay.
Bye.